Closer to home, a health official from UVM Medical Center is breaking down how Omicron affects the unvaccinated, vaccinated, and the boosted. Local 22's Dana Casulo is live in the newsroom with what you need to know. Hi, Dana.
Hi, Courtney. According to Dr. Tim Leahy, the infectious disease physician at the University of Vermont Medical Center, people who are vaccinated are 30 times less likely to end up in the ICU compared to someone that is unvaccinated. Infectious disease physician Dr. Tim Leahy wants to clear up confusion about vaccines and COVID, including a common misconception that if you are vaccinated and get COVID, your vaccine doesn't work.
What you see in people who are vaccinated is that they can still get infected, although it's much less likely. What they are hugely protected from are the bad consequences of disease.
People who are vaccinated are 30 times less likely to end up in the ICU compared to someone who doesn't have the shot.
For me, when I hear that a vaccine makes me 30 times less likely to end up in an ICU with a tube down my airway, I'd say that's a vaccine that works.
People who have been vaccinated and boosted have much more milder cases of disease with any variant of COVID-19, including Omicron.
In fact, when we've been looking around the world at how severe the disease is from Omicron, it looks like it's milder. We think partly because it's happening in populations that are much better vaccinated.
And by mild, that means a sore throat and some fatigue, but no difficulty breathing.
Getting boosted definitely lowers the likelihood of getting infected substantially.
Dr. Leahy says a consistent pattern they have seen in the pandemic is holidays are followed by increases of cases and hospitalizations.
I suspect that the number of cases is going to rise even more now that Omicron has come to town. The hope is that highly vaccinated Vermont is going to have some insulation against severe disease that lands people in the hospital and in the ICU.
But Dr. Leahy still remains optimistic
that we can take this on just like we have every other surge and do our best and show people what neighborliness looks like.
According to the health department, 85% of Vermonters ages 5 and up have received at least one dose of the vaccine. Reporting live in the newsroom, Dana Casulo, Local 22 News.